So, ja, schön, dass ihr alle da seid. Wir haben heute einen ganz tollen Tagesordnungspunkt. Und zwar begrüßen wir heute Viktor Mravlic. Viktor ist Associate Professor, MD, PhD. Das heißt, er ist ein Medical Doctor, promovierter Arzt. Er hat seinen Abschluss in Medizin 1993 gemacht, sich danach in Hygiene und Epidemiologie spezialisiert. Seine Doktorarbeit aus 2013 befasste sich mit präventiver Medizin. Seit 2018 ist er Associate Professor an der Medizinischen Fakultät der Karls-Universität in Prag. Und von 2002 bis 2021 stand er dem Czech National Monitoring Center for Drugs and Drug Addiction vor, eine Institution der Regierung. Und seit 2022 ist er Berater des tschechischen Drogenbeauftragten. Der tschechische Drogenbeauftragte ist heute leider nicht mit dabei. Wir hatten das zuerst angedacht. Das ist Jindřich Voboril, nämlich, der ist auch seit 25 Jahren mit öffentlichen Gesundheitsfragen beschäftigt und hat auch mehrere Delegationen für die tschechische Regierung bei der UN geleitet, hat auch die größte NGO in der Tschechischen Republik gegründet, die sich mit Abhängigkeit beschäftigt. Und war das schon mal von 2010 bis 2018 und jetzt seit Februar 2022 wieder. Also das ist so ungefähr das Pendant zum Bundesdrogenbeauftragten, zu unserem Mitglied Burkhard Blinert. Hello Viktor, thanks for being with us today.
Thank you. Guten Tag.
Guten Tag, hello. So maybe a short introduction to the situation in Germany. We are in the situation that we see a Bundestag hearing on the 16th of November. And the German Bundestag is to agree on a law that will allow possession of cannabis up to 25 grams, 3 plants for home growing, and cannabis cultivation clubs. Details are still to be discussed in Germany, in the Bundestag with the Ample Traffic Light Coalition. And we have the situation on HHC here. I will mention that because it's part of your draft you're working on in the Czech Republic. HHC is not listed in the Cannabis Act. It's the same with Kratom. Kratom is also not listed in the annexes of the Drug Act. And it's very, very popular. You see HHC everywhere in all these CBD stores and all these hemp stores. They are selling HHC. But authorities are now starting to attack single trading companies on the ground that if the substance is intoxicating, it's a health risk. That's their reasoning. It's not scientifically proved right now how this intoxication really works, but as they assume that and as they have user experiences, they say no, it's probably intoxicating, so it's the health risk, and we ban you from trading these substances. The same with CBD flowers. There's also the discussion that, or the history of misuse of intoxication was assumed by the courts early in 2019, and it was confirmed by the Federal Supreme Court in 2021 that hemp and CBD flowers and even hemp leaf tea have a misuse of intoxication, because if you bake enough of these stuff and decarboxylate it in your oven, you may be able to release some of the THC to your body. But it's all very disputed, and there's no real solution. We are hoping that at least this law will be skipped by Bundestag in 2 weeks' time. Otherwise, we still have problems with the CBD flowers as well. So that's a short introduction from Germany, and now we are very happy to listen to your project, to your initiative from the Czech Republic, how to deal with these substances in the future.
Thank you very much. Thank you for invitation for your meeting. I will speak in English. I'm sorry I can't understand and I can't speak German. So in English. I was introduced. I'm a medical doctor, epidemiologist. Whole my professional career, I'm dealing with drugs, drug situation, drug policy. I'm advising, or I was advising in my previous function as a head of the National Monitoring Center, being located in the office of the government. I was advising to national drug coordinators and governments how to shape drug policy. What we are doing now? I try to describe it as clear as possible. First, context. Since 2019, we have the current national drug strategy, which is different from previous ones. It is named not the strategy on the illicit drugs or strategy to fight against and so on. It's clearly named the strategy to prevent and to decrease the harms of substances and addictions. And it says much about the content. One of the priorities of the strategy is to regulate the supply of substances based on their risks. On the context as well, we have a new government or current government since the beginning of 2022. And in the government program, it's clearly stated that psychoactive substances should be regulated according to their harms. And there are also other commitments of the governments, for example, on the decrease of criminalization in general, or on the support of prevention and harm reduction and so on. So what I want to say, there is a context, there is a window of opportunity for the policy changes in drug policy. With the new government, the coordination of drug policy changed as well. So we have Jindřich Vobořil in this position of the National Drug Coordinator, and I am scientific advisor to Jindřich Vobořil. And in this team around Jindřich Vobořil, we started basically 3 initiatives policy towards decriminalization and legal regulation. First initiative is, or first package, is on decriminalization. So here we are trying to change the provision on the drug promotion. It's basically unclear provision, and different human behavior is prosecuted according to this paragraph in the penal code. For example, edition of a book on cannabis, or a magazine on cannabis, or legalization on one side, but promotion of drug use, for example, to children as well. So it's sometimes misused to prosecute people and citizens who are trying to change the drug policy from prohibition towards more reasonable approach. So first, drug promotion. Second, cannabis possession and cultivation for personal use. It's somehow weird situation in Czech Republic, because distinguish between cultivation for personal use and cultivation for others, and possession for personal use and possession for others. But in reality, people, and we distinguish also between small amounts and higher than small amounts. So in small amounts, it's administrative offense, and in higher amounts, it's a criminal offense. But in reality, people who cultivate cannabis in small amounts for themselves, for their personal use, which is administrative offense, if they harvest and dry the cannabis and they possess the cannabis which they produced or which they cultivated, they are prosecuted for the drug production, drug dealing, which means much higher sentences under criminal code. So we are focusing on this to change it, to change the penal code, to define better this possession for personal use and cultivation for personal use offenses, and to decrease the sentences basically. So this is second thing in decriminalization, and the third thing in the decriminalization is to decriminalize possession and handling with controlled substances in context of the treatment, harm reduction, helping services. It regards the programs like drug checking or drug consumption rooms, which, according to interpretation of law enforcement authorities, are illegal because they are related to the possession of illicit substances. People, clients who attend those services possess the drugs, which is illegal. So in this regard, law enforcement authorities somehow hamper implementation of those services. So it's the third thing in decriminalization we are trying to change, to change the provision of the law on controlled substances, to change it. So it is decriminalization. And then we have two other initiatives. First of them is initiatives in legal regulation. First of them is cannabis. So similarly to Germany, your first pillar and the second pillar approach, let me say so. We are now close to proposing the bill consisting on the cannabis regulation, which, as in Germany, would be in three things. So cultivation, possession, cannabis clubs, and also some form of retail. I'm not going into details now. So this is what we are working on. And the last thing is the bill on psychomodulatory substances. And this legislative framework is now in the parliament. It is already after the first reading, means it's now on the agenda of the parliament. In 2 months maximum, there will be second reading. And this legislative framework is intended for substances which are not controlled under international law and consecutively under the Czech law. So kratom, low THC cannabis, potentially HHC and other semi-synthetic cannabinoids. And basically this psychomodulatory substances framework is based on assumption that these are substances which are not controlled internationally, can be controlled and regulated at the national level. And for those substances, we are creating the framework to allow marketing of those substances as a distinct product. So here we somehow change two paradigms. First paradigm is that, and Kai already mentioned that, substances which are psychoactive shouldn't be sold for human consumption. And we say no, psychoactive substances can be sold as a distinct product intended for human consumption. And in a law, it says with acceptable substances with acceptable or low risk, health and social risks. Yeah. And the second paradigm we change here is everything which is consumed by people should be either food or medical drugs. So we change it as well, and we say no, there is distinct product based on the psychoactivity, which is not food, which is not medical drug, which can be marketed for human consumption. And this legal framework defines everything from production, packaging, labeling, restriction of the supply, and so on and so on. Similarly to tobacco or alcohol. But it's it's stricter than tobacco and alcohol marketing. And that's it.
Thank you very much, Victor. Very interesting. I might give a German summary of what you just said, so that everyone can follow here who is not speaking English so well. Ja, also das Wichtigste, was Viktor gesagt hat, man will jetzt in der Tschechischen Republik diese Substanzen regulieren, und zwar auf der Grundlage ihres Risikos und entsprechend den Gefahren, denen diese Substanzen auslösen können. Und da will man einen Unterschied machen. Dann gibt es diese drei Säulen. Es gibt die Dekriminalisierung. Innerhalb der Dekriminalisierung will man ja für kleinere Delikte die Strafen nur noch als OVI ausgestalten. Bei größeren Produktionen, bei Anbaugeschichten bleibt weiterhin das Strafrecht in Kraft. Dann geht es auch in der dritten Säule um Harm Reduction, genauso wie in Deutschland hier. Drug-Checking soll eingeführt werden, gerade auch bei den kontrollierten Substanzen. Die kontrollierten Substanzen, das ist dann halt auch wirklich das, was auch in der Single Convention in den Annexen steht. Das heißt Heroin, Kokain, Morphium, Opium etc. Hinsichtlich Cannabis soll tatsächlich auch ähnlich wie in Deutschland Eigenanbau, CSCs, aber auch Retail, also eine kommerzielle Route eingeführt werden. Da sind wir bisher noch nicht so ins Detail gegangen, hat er gesagt. Und dann gibt es das Gesetz für die psychomodulatory Substances, also psychomodulierende Substanzen. Und das ist vor allen Dingen für diese Substanzen gedacht, die nicht kontrolliert sind unter dem internationalen System, also unter der Single Convention. Die sind nicht gelistet, haben aber trotzdem einen psychomodulatorischen Effekt, wie Kratom, wie HHC, wie auch andere semisynthetische Cannabinoide. Und die sollen alle von diesem neuen Gesetz erfasst werden. Und zwar als eine gesonderte Produktkategorie. es gibt Medizin, es gibt Essen und es soll dann diese psychomodularen Substanzen geben, die als neue Kategorie von diesem neuen Gesetz erfasst werden. Und die werden auch dann reguliert, die sollen auch in Shops verkauft werden können mit Vorgaben zur Produktkennzeichnung, mit Packungsbeilagen etc. etc. Und das Ganze soll dann aber auch strikter als Tobacco, also reguliert werden. Okay, thank you very much, Victor. My question is, do you have scientific deliberations in these categorizing these substances, or how do you work with that? How you start with that?
Yes, this you are asking probably to this psychomodulatory substances, yeah, the framework. Yeah. In this legislative framework, there is a new provision on the evaluation of risk of substances, saying first, substance should be controlled on kind of preliminary or provisional list. This can be done very quickly, and after this control, there should be an evaluation, basically risk assessment, and based on the risk assessment, and the law says the different points and content of the risk assessment. And after risk assessment is done, government will decide whether substance should be controlled as a psychomodulatory substance or as a narcotic and psychotropic substance, or maybe substance will remain on this provisional list. This provisional list simply says the marketing is forbidden, but substances listed here on this list are not controlled, and especially sentences are not that strict as for the narcotic and psychotropic substances. Yeah? So there will be evaluation, but as I said, psychoactivity and the potential of intoxication and also potential of addiction is not the sufficient reason for prohibition of the substance. So we don't say it in the legislation, but we say it in the justification. We say psychoactivity, including positive effects of the psychoactivity, should be acknowledged, because I mean, people and society use these substances historically also for beneficial reasons, right? So it's not like a risk assessment of under the medical law, where psychoactivity is regarded as a clearly negative effect. But here, I mean, psychoactivity is acknowledged as a quality of the substance, but of course, I mean, we say this is for substances which acceptable health and social risks.
Also er hat gesagt, dass das wissenschaftlich evaluiert wird. Es wird eine Risikoeinschätzung vorgenommen und die wird dann miteinander abgewogen sozusagen.
Also nur kurz zu ergänzen, also wie Kai gerade schon gesagt hat, es wird Risikobewertungen geben bei neuen Substanzen, die halt, also neue, das können auch traditionelle Produkte sein wie Kratom, Kava oder sonst was, aber wichtig ist, dass halt nicht wie normalerweise sobald man quasi herausfindet, okay, wenn man zu viel von der Substanz nimmt, kann man eine Abhängigkeit entwickeln oder man kann Gesundheitsschäden bekommen, das ist nicht mehr per se ein Grund, eine Substanz zu verbieten, ja, sondern entsprechend mit den Risiken aufzuklären, ähnlich wie bei Alkohol und Tabak, wobei aber, was die regulatorischen Regeln angeht, also was Stichwort Werbung, Steuern, Preis und so weiter, da hat er keine Details gesagt, wird es aber strenger reguliert als Alkohol und Tabak. And now I can also ask a question. Maybe first I have to introduce myself. My name is Fabian Steinmetz. I'm also, and I should say hi from Jacob from the European Kratom Alliance. And I'm very curious because I'm also a scientific advisor in this group. I'm curious, Kratom, where you draw the line, because on the one hand, you have a traditional leaf powder, which is very popular, but there are more and more extracts coming on the market, and they, of course, have a higher risk profile. Did you already thought about this? Because formulation of a drug is sometimes actually more important than the actual active substance. My favorite example is, of course, always cocaine. Coca tea is more or less harmless. Crack is probably the opposite. So, and we know we want to avoid that there are particularly harmful formulations. Thank you.
Yes, thank you. Yes, legislative framework, this law simply give provisions for the, simply clearly say that psychomodulatory substance should be marketed only in so-called unit packaging. There is a regulation of the quantity of the substance, maximum quantity in the package, maximum concentration of active substances or active compounds of the psychoactive substance. So for kratom, there will be a regulation of mitragynine and 7-hydroxymitragynine, right? And the maximum amount of the active compounds. So and this is already provision in a law, and then there will be the decree providing more details for each of the substance. Yeah, so for sure, the quality of the substance and the I would say purity, yeah, of the substance with regard to active ingredients is very important. Yeah, so in this way, we are regulating, limiting the harmfulness of the substance as such.
Okay, thank you very much. I briefly would translate. Also es wird so sein, dass Substanzen, die quasi noch nicht unter deren Betäubungsmittelgesetz fallen, aber halt reguliert werden sollen, dass diese trotzdem dann weiter spezifiziert werden. Das heißt, man wird sagen, okay, diese Droge ist nur in Ordnung, wenn sie so und so viel Wirkstoff enthält, wenn die Packungsgröße nicht größer als so und so ist. Also man wird sich dort, was die Formulierungen und Spezifikationen angeht, auch Gedanken machen und die werden ein Teil davon sein. Das hat er auch eben übrigens auch impliziert im Kontext von Hanfprodukten, wo er gesagt hat, dass Low THC und High CBD, also niedrige THC und hohe CBD-Sorten, dass die ja auch quasi, das ist ja dasselbe Produkt, ja, ist ja auch Cannabisblüten, aber es ist halt mit dieser Spezifikation, ist es quasi, dann kann es quasi in diese Psychomodular-Schiene rein und damit können quasi auch ja, ein Verkauf reguliert werden. Noch jemand Fragen?
Erste Frage. Ich würde gerne den Ist-Zustand der Cannabis-Gesetzgebung wissen. Dann, es ist beabsichtigt, ja, Teil zu legalisieren und dann voll zu legalisieren. Und meine dritte Frage ist, inwieweit orientiert sich die Tschechische Republik an die Politik in der Bundesrepublik Deutschland?
Okay, so 3 questions related to the current cannabis bill in the Czech Republic. The first one is how far is the bill? The second question is it will there be different parts, like in Germany, for example, there's first a part where it's just decriminalized, including the allowance for cannabis social clubs or cannabis growing clubs, I don't know. And then, and then with pilot projects, we actually want to enter a proper legal market, but currently we are so scared, to be brutally honest. And the third question is exactly referring to that, and this is, do you talk with your German counterparts, and do you orient yourselves around that you are aiming for the same thing, for example, on a European level, and maybe pushing for the same legislation at the same point, or the same legalization package at the same point?
Yes, thank you.
Sorry, one remark, and please confirm that you're not waiting for Germany, because we are cowards.
That's my question.
No, you are not. You are not, because we all we know that it's difficult subject, and it's difficult issue, and reform should take into account many aspects and points, from international law to domestic political situation. Yeah, so it's really difficult. So I understand the process in Germany and some reservations of Germany. Yeah? So we understand that in Czech Republic as well. To your question, I will start from the end. There is a group of countries in Europe which are considering the drug policy reforms and cannabis reforms. So those 5 countries are in closer contact, and they are meeting together, and they are discussing their approach. So we are in contact with others, including Germany. But as I said, situations are different, political debates are different, national laws are different, political situations are different. So that's why also what we are doing at the national level simply has some differences. But yes, in Czech Republic, in principle, we go and we think and shape what we are doing in the same direction. So the less problematic is the decriminalization of personal cultivation, possession, and association in the kind of associations or clubs. Yeah. More problematic is retail. We very probably will not draft the bill according in phases. We would like to have one bill, one shot, yeah, including kind of retail. It's still discussed at the level of the government. We have 5 parties in the government, so it's complex. Especially Christian Democrats are the most traditional and yeah. So it's still discussed, but now we are really very much working on the how to shape the retail, and our idea is to go as much as possible from this principle of decriminalization of possession and supply for personal or supply simply possession for personal use, and to extend it as much as possible also in the principle of legislation and the concrete provisions of legislations to the kind of retail, yeah, and to simply shape the retail according to this, and according to some provisions also of the international commitments. So how is it in English? Conventions, yeah, international conventions and convention on narcotic substances and so on. So it's not ready. It's still it has not been, I mean, submitted as a bill. It's still under preparation in the final stage, but it's very close to the discussion, official discussion of the bill in the government. Yeah. Well, first reading is in the parliament. Here, we would like to have an initiative as a governmental initiative. We have it slightly different in Czech Republic. We have either parliamentary initiative or governmental. And here we would like to have a governmental initiative, so it should be first discussed within the government and then submitted to the parliament. And yeah, so this will be the procedure very probably for cannabis.
Okay, then I'll briefly try to translate. Also sehr viele Unklarheiten, sehr viele Unsicherheiten. Es gibt 5 europäische Länder, die sich regelmäßig treffen. Und dazu gehört halt auch Deutschland und die halt zusammen über Legalisierung sprechen. Ich nehme an, das ist Malta, Spanien und so weiter. Tschechien, Luxemburg, wir, das sind wahrscheinlich 5. Dann, was der eigentliche Entwurf angeht, also es kann natürlich sein, dass gewisse Aspekte von Cannabis quasi schon diesem anderen Entkriminalisierungsvorhaben mit abgedeckt sind. Aber was halt Kultivierung und auch Abgabe in beispielsweise Fachgeschäften oder Clubs angeht, dort ist Tschechien wohl nicht ganz so weit, wie wir mit Säule 1 zumindest. Also das heißt, die sind jetzt noch vor dem Kabinettsentwurf, wenn ich das richtig einordne. Das heißt, es dauert wohl noch ein bisschen, also bis die erste Lesung stattfindet.
Okay, we have time for one more question. I have one question. You guys have a question? No? Okay, so we looked at psychomodulatory substances, we looked at cannabis. What about the hard drugs? Because cocaine, for example, is and crystal meth and etc. Are the most vicious problems we see on the streets and which cause in society. What kind of deliberations do you have in the Czech Republic for complete decriminalization of hard drugs as well, or you just focus on harm reduction for the time being?
Some of the changes in decriminalization will be valid also for other drugs than cannabis. So those changes will be general. But this is just for decriminalization. As for legal regulation, there is nothing on the table now for other drugs than psychomodulatory substances and cannabis. Maybe psychedelics. Yeah, there is some initiative on the psychedelics and psychedelic assisted therapy and psychedelic harm reduction, but not for example, methamphetamine or cocaine or heroin and so on.
Okay, thank you very much. Some more questions? We are perfect in time. Thank you so much, Victor, for being with us today. It was very informative.
Maybe last point from me. Maybe last point from me, which is important. The legal framework for the psychomodulatory substances is based basically, as regards the acquis communautaire, European law, is based on the provisions on the new psychoactive substances. And in concrete terms, in the provision in the Council framework decision on the minimum sentences and so on, which says the substance which is not controlled at the international level and at the EU level can be controlled at the national level. Yeah? So this is the basic provision. At the EU legal framework, we base our psychomodulatory substances legal framework on, yeah, which is important with regard to EU.
Yeah. It guarantees a safe legal framework.
Yeah. Okay.
Perfect,
So,
Victor. See you next week in Prague. I will come to Canafest.
Bye. Take care.
Okay, also from me.
I wish you a successful conference. Goodbye.
Also from me as chairman of our meeting, thank you very much, Mr. Moravcik.